Hamilton County was awarded a $250,000 grant to help with opioid use disorder treatment at the jail.
Our Cornelia Nicholson is joining us in the studio to give us more details on this new program. Cornelia.
Greg, David, the new program is called Medicated Assisted Treatment, or MAT for short. It'll provide medications for opioid use disorder combined with therapeutic and behavioral support to help inmates overcome substance abuse.
The vast majority of inmates in any incarcerated setting have some type of addiction.
Research shows the leading cause of death among former inmates is drug overdoses. Rebecca Bohannon with Hamilton County Government says this is why District Attorney Cody Womp, Hamilton County Mayor Weston Womp, and Sheriff Austin Garrett worked to get the Medicated Assisted Treatment pilot program funded.
Essentially, when someone has an opioid use disorder, withdrawal symptoms will ensue if they are not taking opioids. That can look like a severe COVID or a severe case of the flu.
Bohannon says when someone is going through withdrawals, their focus is on the physical symptoms and they're unable to work through their addiction and trauma. Through the program, they'll be given medication that will mitigate some of the physical symptoms and manage triggers so they can begin the behavioral therapy process.
Sheriff Garrett was very clear to me in the beginning. He wanted to make sure that if we start this treatment, we also provide follow-up appointments for the inmates once they're released. So we're partnering with Helen Ross McNabb. Any inmate that comes into the MAT program, they will also have an MAT appointment post-release.
Hamilton County was one of 10 counties across the nation selected to be a part of a federal cohort and apply for the grant. Through this cohort, Bohannon says they're learning from partners across the country on the best way to determine eligibility for the program.
We certainly want to bring in as many inmates as possible. For those who want it, this is going to be voluntary.
This will be the third MAT program in the state. Bohannon says this program is how corrections should be done.
There's enough barriers in the way when an inmate is released from incarceration. The last thing we should expect is that they can navigate a really complex healthcare system. So if we can start that while they're incarcerated, warm handoff post-release, that's how we really generate success.
Bohannon says training for deputies, medical and clinical staff is set to begin this fall. David.